Welcome back, ladies and gentlemen, and joining us here tonight in the studio to shed more light on the health fire, we're joined by Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University. Dr. Anan, thank you very much for joining us.
Thank you for welcoming me, Hadi.
Dr. Anan, first off, before we start talking about the ending the waiting list initiative of £1 million, let's take an overview over the development and the efforts exerted to develop the healthcare system here in Egypt. Now, we've been really carrying out a lot of initiatives, be it the 100 million healthy lives, the premarital medical initiative, also the mother and the fetus initiative. I mean, many initiatives, but let's take an overview and evaluate how the development has been going on for the past few years.
So this is a very good starting point, Mr. Hani. So we can say that the healthcare system is changed dramatically at 2018. Because in 2018 we launched the 100 million healthy lives initiative, and we started with hepatitis C elimination plan. And it was the biggest screening program worldwide. We screened in Egypt 50 million citizens. And we managed in 18 months to eradicate hepatitis C and get the certificate from the WHO. And from the 100 million healthy lives initiative, we got a lot of initiatives cascaded, which, like you mentioned, the Women Health Initiative, mainly focusing on breast cancer and ovarian cancer. The Mother and Fetus Initiative, which is actually screening. So far, they screened 2 million mothers for all viruses, HIV, HBV, HCV, as well as diabetes and hypertension. So it's a huge project where you can follow the pregnant mothers of Egypt. You know, every year we do have around 2.5 million pregnant women and 2.5 million new child babies. So the aim is to cover almost 60 to 70% of the new mothers. Another initiative, which is very important one, is to manage both the children in the anemia and obesity and stunting, as well as geriatric health. So we are covering, if you look at the initiatives, and we are talking about 20 presidential initiatives for health, we are talking from the pregnant mothers, the babies, children, the school children, even the school meals. Then you go for chronic diseases, viruses, and finally for geriatric care. So it is covering the what we call the patient journey, and it's covering the, even which is more important, the healthy lives before the disease. Because you can target actually the disease itself, or you can target protection and preventive medicine and trying to prevent the lasting of the disease itself. Like, for example, what we were just saying about anemia. So anemia, it will actually make a lot of consequences for the children in the school. So they can make them with less grades in the school. They can actually develop in the future many stunting diseases and many malnutrition diseases. So starting 2018, it was a starting point to change the perspective of the healthcare from just treating the patients who are actually going to hospitals to trying to make a strategic map till 2030 to have a good disease map. So we have less infectious diseases, less non-communicable diseases, as well as controlling diabetes, hypertension, dyslipidemia, and so on. Hopefully, because currently we are covering more than, you can say around the last statistics, 120 million visits to the presidential initiative outlets. So the main aim is at 2030, we do have a preventive care. We do have, as the benchmark, the global benchmark of all the infectious diseases, and you have better control for chronic diseases, because we do have a huge problem in terms of chronic diseases, like diabetes, for example. We do have around 15 million patients. In terms of hypertension, we do have 20 million Egyptians suffering from hypertension. The main problem is controlling them, because the level of control is around 20%. Maybe less sometimes in some rural areas, it can go to 10%. So aiming to control them, it will decrease mortality. You know that cardiovascular diseases is the #1 mortality cause in Egypt. So we are trying the maximum to make what we call longevity and longevity of the health lives of the Egyptians.
Yes. Well, let's talk about ending the waiting list initiative. Now, the president directed the Long Live Egypt Fund to allocate £1 billion to end these lists. Now, these lists, it's a huge list.
Yeah.
And these are, I mean, they qualify as emergency sort of cases. But what sort of diseases or emergency cases have the priorities within these lists? And is £1 billion enough to end the waiting lists for all Egyptians throughout all the governorates?
So the 1 billion is to complete the fund. The fund started at 2018, and so far till the beginning of 2023, it was 10 billions so far spent on the eliminating waiting list. So we are adding extra billion to make sure that there is a sustainability in service. And the waiting list is not an Egyptian problem, it's a global one.
Yes.
If you look at the NHS in the United Kingdom, they do have 2 million British people or citizens on the waiting list every day. And sometimes it goes for like 3 to 4 months waiting for their operations. Mainly the waiting list is coming because of the pressure on the healthcare system in terms of there is no enough resources and there is no enough operating rooms and surgeries. So what they've done here in Egypt in the presidential initiative is actually how you can manage strategically as well to have the resources in terms of funds, and resources which is very important in terms of human power. So having trained surgeons, having operating room they can operate in, having surgical procedures, having qualified nurses and clinical pharmacists who can actually operate inside the hospitals. So the allocated is mainly for transplantation procedures. So we are talking about kidney transplantation, liver transplantation, which is a big surgery, not a small one. And we are talking about as well heart diseases. So we're talking about stent, for example, operating inside the heart. We're not going to give a lot of jargons, but the cardiac problem itself contains a lot of from small to big surgeries. All of these are the priorities in terms of eliminating the waiting list. And so far, they managed to put a time, what we call a TAT, a turnaround time, which is the moment the citizen will actually apply for the surgery and then going to a committee, getting the approval and do the surgery. Usually in the global benchmark is around 3 to 4 months. Currently, some procedures are done in less than 1 week. So it's a big achievement. The average is from 2 weeks to 3 weeks. So this is a very good waiting list turnaround time for all the mainly transplantation and cardiovascular diseases.
But what would you say are our main problems? What is the main problem to end these waiting lists? Are we talking about, is it a question of financing or an issue of trained surgeons, or is it the actual operation rooms and the hospitals? Where do we fall short?
Okay, so this is back to the strategy itself. So the main thing about the strategy is trying to solve the roots of the problem, because we do have a lot of risk factors that emerged having too many patients applying for surgeries, for example. Something like what we were just saying about non-communicable diseases, hypertension, diabetes, cholesterol level. These are actually predictors for patients or Egyptians that later on, after a couple of years, they will do have problems needed surgery. So we can just put a lot of resources just to do the operations and surgeries, or we can put a strategy to trying to make better control for the chronic diseases, trying to manage, for example, the food intake. So less food intake, less diabetes, less complications, and less surgeries, and less cardiovascular diseases. So there's two main things here. Trying to prevent from the start that making Egyptians leading better style of life and better quality of life in terms of food intake, in terms of exercise, in terms of routine checkups. We don't have the culture of having routine checkups every year, for example. We are trying to enhance this. For example, in the breast cancer initiative, they managed to screen 25 million Egyptian women. And for me, this is a big achievement, not only because of the number itself, it's because you are trying to change the culture, trying to speak with the women that you need to go, you don't have any symptoms. And you know, all of us, we go to physicians or doctors only when there is a big pain and we are
Yes.
suffering a lot, and then you head to your dentist, you had your internist, and so on. So going without any symptoms, it's an achievement. And second thing is to have the enough resources. We do have a challenge in terms of number of trained physicians, in terms of adding more hospitals and adding more operating room. And hence, as well, we do have a new initiative, which is a primary healthcare initiative,
Yes.
which is how you can refer the right patients at the right time to the secondary care and the tertiary care. So having said all these challenges, there is a root cause that we need to manage, and there is a current situation, which is why we are putting a lot of budget for the eliminating waiting lists for the current patients who need surgeries.
Yes. Dr. Anan, now, when we talk about the development or refurbishing of the medical facilities, there's been a lot of work regarding developing the Nasser Institute, actually in specific turning it into a major medical city, also talking about upgrading the Heliopolis Hospital, the Coptic Hospital, all of these things. Do you feel that they will make a difference? I mean, we're talking about a population of over 100 million. Now, do you feel that they would be enough to at least set the tone for the rest of the hospitals nationwide to develop their own medical services and coverage?
So we are talking about a national reform. So I've been at Nasser Institute just recently, and you can see the difference yourself that it's becoming a good example for the rest of hospitals for tertiary care, for example. We're not talking about just adding more hospitals or building more hospitals. We do have a lot of hospitals, by the way. The main issue and the main challenge was actually how to upgrade the service. And since 2018 as well, and maybe 3 or 4 years before that, there's a very big reform plan on how to enhance the capacity, enhance the resources. We can see that every year there is more than 20,000 healthcare professionals are taking training in the National Training Institute at the Ministry of Health, for example. We can see a lot of actions done by the Unified Procurement Authority, the UPA, in terms of purchasing the new facilities. We're talking about imaging devices like MRI, CT. We're talking about diagnostics and for the treatment itself. So upgrading the services at the tertiary care, Nasser Institute is called tertiary care, where you can actually refer to the cardiac problems, transplantation, kidney, and so on.
Yes.
So having these centers will allow you to do the operating procedures that you couldn't do before. For example, complicated surgeries, complicated transplantation, and it will be very good as well in terms of medical tourism. We do have as well patients coming from abroad, outside the borders, to do the surgeries here. We can take this actually step and enhance the medical tourism as well, because it's one of the main lines we are trying to invest in Egypt. So having 5 or 6 centers like Nasser Institute, medical cities, will enhance a lot, being a hub for medical tourism, like you can see in the Eastern Asian countries, something like Thailand, for example, what they are doing in medical tourism. So a lot of reforms are done. A lot of reforms are needed. The strategy will continue till 2030, till you have a complete tertiary care, which is actually covering all Egypt nationwide.
Yes. Well, you spoke about training the medical personnel and the medical personnel in general, and there has been directives to increase the monthly allowance, the monthly salary for medical personnel by 75%, which is something that many people have been calling for, especially the medical personnel during the coronavirus, because they took the biggest risks. Also teachers, obviously, for the important role they play within the society. How much of a difference do you think this will make in terms of encouraging the medical personnel, getting more people being enrolled in studying medicine, for instance?
So this is a very challenging point. We had around 5,000 resignations from healthcare professionals and a lot of immigrations every year. And so far we're talking about 15,000. So a plan is put actually because of how you can retain the healthcare professionals to stay inside the healthcare system. And it's very challenging because the competition is you are competing with UK, Germany, and the Gulf, trying to offer our physicians and maybe 5 or 6 times the salaries, sometimes 20 times the salaries, and saying that we need to recognize something, that we do have excellent healthcare professionals, we do have very well trained, and that's why they are getting a lot of offers. And how to retain them is not only offers, financial offers. There's a very recent study made by the American University here in Egypt, and I was lucky to be supervising it, that physicians are not only seeking financial offers from abroad. They are seeking just more time inside their hospitals. They are trying to see if they can get more recognition in terms of working in a better hospital, having the tools, having treatment options. And if you are providing that, they prefer to stay than to travel with another offer. So that's actually what we can see the government is doing. We need to increase their financial offers, and that's have been done. Another thing is trying to put as much reform in their hospital as much as we can. So putting the resources, reforming the hospitals will make sure that the physicians are actually, they are retained, they want to stay. And the big aspect you mentioned in your question, which is training. They are getting a continuous training.
Yes.
And the Ministry of Health is putting too much resources in terms of training. There is a minister assistant, only Dr. Ayub Kamal, only for training. His main job is to train healthcare professionals and to train pharmacists and nurses. And every year, as I was saying, more than 10,000 healthcare professionals are getting trained. The big thing about this one is trying to make them take their masters while they are actually operating and actually practicing, their PhD, trying to take on-hands practice on their job while they are inside their hospitals.
Yes. Well, as Dr. Anan has mentioned, it's not just a matter of money, but there are many other incentives that would commit the Egyptian medical personnel to the country and to the healthcare system. And the government has initiated a lot of incentive packages for the personnel and the workers within the medical health facilities here in Egypt. Let's check out this report and we'll be right back.
President Fattah al-Sisi has instructed the government to allocate incentive packages to medical personnel in basic health care facilities and to supply these facilities with the necessary equipment. President al-Sisi also instructed to increase the number of specialized clinics that help meet citizens' needs for pre-marital health care services, as well as those clinics that treat chronic cases and that provide care for the elderly. He also stressed that these facilities must provide 24/7 emergency services. The head of state is keen to follow up the progress of public health initiatives and review current efforts to upscale healthcare services at basic healthcare facilities nationwide. The President is also briefed on the current implementation process of national projects in the health sector and of the timelines for the completion of each project. He has directed officials to adhere to the timelines for the completion of these projects and to work on removing any obstacles that impede the speed of completion. He laid special emphasis on the project aiming to develop Nasser Institute so that it becomes an integrated medical city. President Sisi has given his directives to increase the monthly allowances given to medical professionals by 75% at a total cost of 2.25 billion Egyptian pounds as part of the government's efforts to support members of the healthcare sector. The Decent Life initiative launched by President Fattah al-Sisi is one of the most important development initiatives carried out by the state. The initiative greatly contributes to improving the living standards for inhabitants of the countryside, where projects have been carried out to upgrade infrastructure in all service sectors, notably in the health and education domains. The budget allocated to the health care sector in fiscal year 2022-2023 within Decent Life initiative was £2.8 billion. Those were spent on equipping 15 hospitals and 18 healthcare units and are part of £45.9 billion plan to renovate healthcare services nationwide in the current fiscal year.
Welcome back, ladies and gentlemen. Continuing our discussion with Dr. Anan. Now, sir, when we talk about the healthcare system and the development of it, ending the waiting lists, billions of pounds to end it, but Another initiative, which is the Decent Life Initiative, that targets over 4,000 villages throughout Egypt. Part of it is the development of the health care system. Do you feel that places in the countryside and villages, do they get the same sort of attention that anyone would get in the bigger cities around the country?
Okay, this is the main objective of Decent Life Initiative, because let's go a flashback 20 years or so. You will find that some rural areas in Egypt, they don't have healthcare system, and they don't have the culture of going to a physician and get examination. So sometimes you'll find a high prevalence of hepatitis C, for example, a viral infection, but they are not going to any healthcare facility. They don't have the culture, and even sometimes parents, they don't see the importance of treating their children from any viral infection, and they will just get a normal remedy from a herbal store or something like that. Decent Life Initiative and the 100 million Healthy Lives Initiative, they are aiming for equity, the equitable access of all Egyptians to healthcare system. And the second one is equity and solidarity, and finally efficiency of healthcare system. 3 pillars. So any citizens who is actually born in Asyut, born in Cairo, born in Alex, born in any rural areas, they must have the same equitable access to healthcare. Still Egyptians, they are not actually their choice to be born in any city or any rural area, and hence you need to provide resources. Resources, we mean health units or hospitals inside their villages, inside the rural areas, inside the cities, which is accessible. You need to inject, which is hence Decent Life Initiative, inject the culture of going and seeking medical consultation, which is not an easy thing, by the way. Not all people got the culture of when they having any symptom, they go to the hospital. Most of them, they'll just go to a herbal store, trying to make home remedies and so on. And one of the main objectives of Decent Lives is to make the health caravans, the checking, the screening, and enhancing the culture as well of going to the caravans and taking their blood pressure screened or diabetes. And shockingly, 50% of diabetic patients, they are not actually aware they are diabetic. And they are getting the symptoms, and the symptoms will make them deteriorate in health, and they will only go after it's very deteriorated, and for example, they do have a foot amputation. We do have a huge burden, which is one small item from foot amputation. We're talking about 7 billion Egyptian pounds of burden only coming from this complication. So early detection, early screening will help all Egyptians to have better life, and by the way, will help Egypt to have better economy. Because when you have more healthy individuals, more healthy population, it will impact the GDP, it will impact the whole economy in terms of more productivity from the labor force. So I'm actually looking at this initiative as a very strategic economic program before it's a healthcare program in enhancing our economy and our quality of life for all population.
Dr. Anan, one of the initiatives or launches that all Egyptians were very excited about was the universal health insurance system. Now, it started off, it's a gradual implementation of this health insurance system. It started off in Boursaid, and it's supposed to be implemented within 10 years all over the country instead of 15. But how well or how fast are we going in terms of implementing such a health insurance system? Is it a question of financing? Is it a question of infrastructure? Is it a question of a cultural and mentality thing, as you've mentioned, for the citizens? I mean, what stands in the way of actually implementing, not just implementing it, but having a good standard, a good quality of health insurance coverage?
So this is a very good question. We are moving as a plan. The plan is to cover Egypt in 2032, and the Universal Health Insurance Organization, they are actually taking a city and a governorate after governorate, because it will be very difficult to implement a new system all over Egypt, nationwide, in 1 year, for example. And you mentioned a lot of challenges, and there's a big challenge as well is we do have an old system as well. So we do have the health insurance organization, التأمين الصحي القديم.
Yes.
We do have on a state fund system, which is العلاج على نفقة الدولة. And we do have the Ministry of Health outlets, and we do have a lot of specialized medical centers as well. So we do have a lot of insurance bodies which will actually fade and should be replaced by the new Universal Health Insurance Organization or Authority. So having the change management in terms of old insurance system covering almost 50 million Egyptian citizens to be shifted from the old system to the new system, we're talking about a digitization of the system itself, having an integrated database from the old and the new, moving that even the treatment protocols, it's very difficult. You are moving all the treatment protocols from the old system to the new system. So it's better to have it a governed rate after governed rate. In Port Said, it was a pilot governed rate where citizens were told that their old system will be actually eliminated, and you need to go to the new system for your monthly chronic medications, for example, and you will find that your treatment paradigm or your treatment plan is the same. It will not going to be different. You will having the same medications, but better service, better care. We do have one centralized digital healthcare system that in 2032 should be covering all Egyptians, and it will be a mandatory one. There will be no opt-out on a household. All of us will be insured with the Universal Health Insurance Organization or Authority, and hence you do need a better coverage in terms of hospitals. In terms of hospitals, they can actually apply digitization. So you need digital hospitals because in 2032, the plan is to have paperless system.
Yes.
So currently, you need to reform hospitals, and hence there is a new authority which is called the GAHAR. The GAHAR responsibility is only to make all the hospitals ready for the Universal Health Insurance Organization in terms of capacity, in terms of level of service, in terms of accreditation, because no hospital that's not accredited will be allowed to enter the new system. So you need to reform hospitals, manpower, you need financials, and you need a lot of process in terms of change management. And there is a new KPI for outcomes, key performance indicators for the outcome, that you need to preserve and make it sustainable. So you're not going to repeat the old healthcare system, which is actually after a couple of years, you got stuck in a lot of logistics. So having said that, it's a long procedure in terms of resources, processes, and outcome KPIs that you need to actually put it on a 10-year plan, hence 2032.
Yes. Yeah. Well, one final question, because we're running out of time now. Dr. Anan, you're a specialist within health economics and health policy in general, and you've mentioned many different obstacles or challenges that we need to overcome as a country, starting from the training of medical personnel, the digitization or digitalization of a new system, the financing of it. I mean, you've mentioned many things, but in a macro sort of level, what is the main thing that we should just really root out and try and fix as soon as possible to at least start some sort of a domino effect for the development and strengthening of such a system here in Egypt?
Okay, the key word will be sustainability, because we've done a launch and a kickoff of a new system, which is actually a very good plan in terms of having a new system. All Egyptians will be covered, having resources, digitization and digitalization, both of them. So the kickoff is good, the launch is good. We do have a challenge in terms of the global economy recession, in terms of the decrease of services in general and the export and import problems worldwide. So sustainability plan is what the ministries and the presidency office are trying actually to put a plan for currently. So not only to launch a good project and the project will not continue for a year and two, but making sure that the sustainability goals are actually achieved year after year.
Yes. Well, ladies and gentlemen, as Dr. Anan has mentioned, the key word for such for a successful healthcare system here in Egypt is the sustainability. Dr. Anan mentioned all of the different achievements and challenges laying ahead within the healthcare system, and it is really one of the most important sectors here in Egypt, taking care of the country's biggest assets. the citizens themselves. Unfortunately, that's all the time we have for this edition of the Daily Debate. But before we go, I'd like to thank my very distinguished guest, Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University. Dr. Anan, thank you very much for joining us.
Thank you, Mr. Hani.
Thank you very much, sir. Ladies and gentlemen, please stay tuned for more coming up on Nile International. I'm Henny Saif. Thank you for joining us.